you'll see the bones free floating. It's different when you see them already connected. When they're like in pieces, when it's like, oh crap, you know, where did it go? So you gotta do that. The ulna, might want to get a picture of the ulna. You know, I like to use that little U there. It's like a little U. You know, it's an ulna. And know whether it's lateral or medial in relation, you know, in the anatomical position. Right, so should be
lateral.
Should be medial. The radius is lateral. Radius is lateral in anatomical position. Know the articulation, specifically this particular facet right here, this notch, trochlear notch, articulates with the condyle of the what? Of the humerus. Right, so now, is it on the lateral side or on the medial side? Well, the ulna is medial. Ulna is medial, so it'll be the medial. As a matter of fact, it's called the capitulum. Right. So know whether it's lateral or medial. Then these guys here, I can simply put one of these there, and I can tag this structure there. What is that? What is this called?
Process something.
Well, okay, so these are condyles, right? And then you have these little ones these are the ones that you can actually feel on the side of your elbow there. So these protrusions are condyles. Well, these are epicondyles. So this is a condyle, this is epicondyle, you've got medial and you've got lateral. So make sure you don't get your medial and lateral. And the way that I can tell what's medial and what's lateral is look at the direction of this head. It's pointing in. And these things obviously have to point in because they join a socket of some sort.
So inward is medial?
So inward is medial. Okay. I can ask, same thing here. You know, what articulates at the proximal surface of this bone? So, you know, you're going to see the bone just there, and then you have to know, okay, what's proximal, what's distal? Or I can even say, you know, superior, inferior. All right, so this would be proximal, this is distal. So what bone articulates with the distal end of this bone? So right here, this would be already ankle, right? So you get all right, so it's not the calcaneus. The calcaneus is your heel bone. There was another one, and I said, okay, you know, you will have to move it.
The outside one?
Yeah, the talus, you know, talus. So know that. Know the articulation. Like if I put this there, you should know what that is. I can ask you to name this bone. I can ask you, you know, proximal end or the distal end articulates with what? So in this case, the proximal end articulates with which bone?
The tibia.
The tibia. Okay. I can ask you about this little notch here, or it's actually a process. What was that called? Styloid process, which helps to make what is that called in the foot? Specifically, it was called something. So you had a lateral one and a medial one. So if I tag this right here, what is that called? Starts with lateral. Well, this one actually, yeah, this would be lateral. This is your lateral malleolus. I'm sorry, medial malleolus. This is lateral. The tibial is always lateral. Right, so this bone actually doesn't belong here, but let's just pretend it was. So these are the ones that make those balls on your ankle. Okay, so remember the fibula is lateral, so this is lateral malleolus, and the tibia more medial, so this is the medial malleolus. Okay. What else? Know what three bones make this up, and you can see there that someone actually. But you know, I'm not going to probably do that. I'll probably just tag it here, and I'll ask you what's its name. I can ask you what is the articulation that occurs here, or you know, what bone does it articulate with, and it would be what?
Femur.
Okay, no, I'm asking you what actual bone articulates with this structure here.
Oh, the femur.
Femur, right? Back this one. Like that. Okay, so that's an articulation right there. I can ask you what type of joint it is. Alright, so it's a what? But there was ball and socket, but it's a freely movable joint. And you remember there's synarthrotic, diarthrotic, amphiarthrosis. So you gotta know those words. Right, so make sure you have a look at those. In terms of the bones, these were fused together. I can tag this structure right here. What's the name of this? Well, what's what's the name? This area is what? Well, this what bone is this? Number one. What bone is it?
The belt.
Well, this whole bone is
Ili-
pelvis.
Ili-
So this is the ilium.
Yeah.
And this region here, this depression here is known as the what? This whole little like bowl-like structure here. So if you have a depression of some sort, it's called a what is this called? Olecranon fossa, right? So this is also a fossa. Fossa are depressions, right?
Okay.
Or shallow depressions. So this would be the iliac fossa, right? And this is the iliac bone. This region here is called the iliac crest. All right. If I tag the structure here, what bone of the pelvis is that?
Bottom?
So it's anterior, the anterior part of the pelvis, right? But what's the actual bone called?
Pubic?
Okay, so yeah, you got pubic bones. You got two. What's the name of this joint or what type of joint is this called right here? It's a symphysis type of joint, but it's a cartilaginous joint. Right, so this whole thing is called the symphysis pubis. What type of cartilage is found here? Elastic hyaline or fiber cartilage? Fiber
Fibrous.
cartilage and fibrous cartilage are the same thing. Just before that. What type of cartilage is this? It's the same.
Fibrous.
So this type of joint and this type of joint are cartilaginous joints, the same type of joint. Okay. And this is a pubic bone. This one down here, posterior, inferior posterior, is what? So this is the ilium, pubis. This is ischium. What about these holes? What are they called? It's a foramen. Anytime you see a big hole like that, it's a foramen. These are obturator foramen, and I think in the notes it only goes on to tell you that it's the site where artery, nerve, and vein exit. Okay, you do have obturator nerve, artery, and vein. You should be able to tell the difference between the male and the female. This one would probably be a what? A male.
Male.
This angle looks to be less than 90 degrees. It's more acute. And another way of telling is if you look at this hole in here, the pelvic inlet, or the true pelvis, you can see it's like, okay, I don't think a baby's head could fit through there. Right? Know the name of this joint right here between the sacrum and the pelvis here, or the, what's it called? What bone is this again? And what's this bone? This bone right here, the one that's fused with five vertebrae.
Sacrum.
So sacroiliac joint, right? Iliosacral. Sometimes they do it both ways. In terms of the vertebrae, I can tag this right here. What's the name of this structure right here?
Lumbar.
Okay, well it is a lumbar vertebrae, but I want to know this actual structure that's protruding right here has a name. Because I'm going to just put a vertebrae there and I'm going to tag it, and you have to tell me what is it. It's a big that is a choice. All right, so this is your spinous process. And what about these right here? If I tap either one of these over here on the side, they go sideways, right? So that's transverse. So these are transverse processes. What about this right here? This little bowl. Bowls are foramen, right? And it's a vertebrae, so it's a vertebral foramen. Vertebral body. What type of cartilage rests on this, or in between these? Fiber cartilage, right? So know that. Back to this guy right here. This thing right here is known as what? This little bumpy ridge here that's kind of rough. And I can tag that there. And specifically it's called, well, it's a muscle insertion for the deltoid. Right? Tendon actually anchors itself in here, and that's the deltoid tuberosity. Okay. Another structure that's important here, I can ask you what structure articulates within this fossa. So you have to know, okay, this is the olecranon fossa, and here's the ulna. So this is what's this called right here? This little pointy region here. So this is a trochlear notch because, well, they call it trochlear notch because it's actually in the trochlea. And you have a capitulum. Capitulum's inside. I'm sorry. Capitulum is medial. Trochlea is lateral. So where it touches, basically that's where it hinges, right? But this part right here is the olecranon process. This actual notch, right? This piece of bone is what locks this into place and it prevents the arm from hyperextending. So it's like, that's as far as it goes. Alright, another one that's tricky. Know the sutures. Okay. Immovable joints, obviously they're sutured together. That be able to classify the type of bone, it's flat bone. The bones of the face are irregular bones, right? And you got your maxilla up here, the jaw is missing, but the jaw is mandible. Frontal, parietal, occipital, temporal, and you do have a little small portion in this region right here that's the sphenoid bone. Okay, and you can also see it from the top if we open. This was also in the first part of notes. It mentions there's a little landmark here called the sella turcica. What structure rests in there? What structure of the brain, or part of the brain rests in there? It's a little tiny chamber. Releases all the hormones, major hormones of the body.
Is it in the thalamus or the hypothalamus?
Well, that's actually superior to that, and then this little thing kind of comes out. That's your pituitary gland. Right, so your pituitary gland. And so the hypothalamus is actually superior to that. So this is part of the sphenoid bone. And this one right here with the crista galli talks about that. And you have nerve endings for, that's how you smell stuff. Right? When you smell stuff, your receptors or neurons are there. That's ethmoid bone. Right here. So this is known as what? It's an arch, right? Or what's it called? What's the name of this bone? Cheekbone. Zygomatic bone. Right? So this is a zygomatic bone. This is a zygomatic arch. And this bone right here is what bone? Temples. Right? So the temporal bone.
What is it called when it comes together?
Like the suture?
Like, you said something about when they, like, here or something.
The temporal and the sagittal.
And the zygomatic.
The arch, well, I'm going to tell you if I tag this structure here, right, so like this is a zygomatic arch, but if I tag this part of this arch, this is a temporal process of the zygomatic bone, and this part right here is a zygomatic process of the temporal bone.
Oh.
So you might want to spend some time with that because
Like
sometimes, you can
So it's like
get it confused.
the opposite.
Yes,
Yeah.
it's like the opposite, but it has the name of both bones. But just make sure that it's crisscrossed. Don't go putting here, this is a zygomatic process of the zygomatic bone, and this is a temporal process of the temporal bone. You have to have both names. So temporal process of the zygomatic bone, zygomatic process of the temporal bone. And then, of course, there's a squamous suture up in here. Make sure that you know what bones make up what suture. So, what suture makes up the sagittal suture. What bones make up the sagittal suture. So this is a sagittal suture for your left and right parietals. Your lambdoid suture is made up of what bones? So the occipital and both parietals. Right? The one that can be tricky is the squamous suture because the squamous suture is at least 3 bones that I can remember. You have your temporal, sphenoid, and you also have occipital. Did I mention parietal? Yeah, parietal, temporal, occipital, and there's also sphenoid.
So it's all except frontal.
Yeah, so I can ask you all of the following bones make up the squamous suture except, and there'll be one that doesn't belong. Alright. What else? Oh yeah, so the bones of the hands, I'll go ahead and put that in the review in terms of so along the pinky, here comes the thumb. One thing we know the ribs. Alright, so what are these type of ribs known